Good evening. Welcome to the Evening Review. My name is Junias Shilunga. Let's take a look at today's newspaper before we proceed to the interview.
Dear invited guest, the Northern SME Expo team is aware of the current restrictions imposed on the country by Honorable President Hage Geingob as from the 12th of August 2020. However, we have developed a system that we can use while adhering to the new regulations. Our team will provide you with a ticket that contains details of the media launch as well as a timestamp at which your presence is required. As per new regulations, only 10 individuals will be present in the media hall as per timestamp indicated on the ticket. Thank you for understanding and for your cooperation. We are excited to see you on Friday. For any queries, please contact Nangula Nashandi on 081 4769 304.
This event is proudly brought to you by Chico Group of Companies.
Good evening and welcome to the Evening Review. My name is Junias Shilunga and I'm joined by Mr. Junias Shilunga, who will be speaking about the plight of nurses during the COVID-19 pandemic. Good evening, sir.
Yes, good evening, my brother, and good evening, viewers.
To get a sense of the union, what does the union stand for, and how many nurses do you currently represent?
Very much for the question and for the opportunity. I represent the Nurses Union, the acting Secretary General. The Nurses Union is a registered labor union within the nurses, and we are there to represent, negotiate on behalf of the nurses in the number of the nurses were part of the union. I cannot really the figures, but we represent a majority of the nurses are our members.
And then, would you say that how many of your nurses would you say are currently on the front lines and have to deal directly with the COVID-19 pandemic and its patients?
To be specific, all the nurses are on the front line now. As long as they are working in the hospital or health facilities, because now we have transmission. All the we are treating, they are being treated as the conduct of COVID. So all our members who are working, they are on the front line during this pandemic.
We recently celebrated Heroes Day, and the President, His Excellency Dr. Hage Geingob, made a special mention to the nurses, to the frontline workers. Do you feel motivated after getting the praise from the head of state?
it is not really motivating to hear word from the head of state. Looking at the working conditions of our nurses, looking at the sacrifice they are making, we feel that our nurses are not appreciated, still receiving slave wages, which were not increased for about 2 decades now. And for the presidency just to thank the nurses by the word of the mouth, for us, is nothing to us, because we the president at least to provide some incentive in his capacity to release some funds as a token of appreciation to our nurses. That is what we expected from the presidents during the Heroes Day celebration.
Mr. Shilunga, what would you say currently, as far as your valuation is concerned, are the biggest challenges that are facing frontline workers, particularly nurses and doctors, but more so nurses?
Yes, I represent the nurses and to misrepresent some groups. The challenges that are facing our nurses in this country is the shortage of PPEs and the shortage of nurses in our health facilities. Our nurses now are overwhelmed and they are battling burnout because of the workloads that they are getting. And, we expected during this time of this state of emergency, at least the government to provide even transport for our nurses who are staying far, so that we can avoid cross transmission of the virus. Because some of our nurses now they are using taxis, and when they are going to using taxis and going back to their houses, and in those cases sometimes they can get those those people who are affected unknowingly, and they become infected in the process also.
On the issue of protective equipment for nurses, what has your union done to address this issue, and what is the message that you are hearing from government about how they intend to solve the shortage of PPEs?
Yes, we have written letters to the ministry, and we have written numerous statements. We also called a meeting with the executive directors of the ministry, and all they told us it was that they are going to procure enough PPEs. But what is surprising us is the rise of the virus among the healthcare workers, and the reports that we are also getting from different health facilities that they are in need and they are in a critical shortage of PPEs. So it is not easy at this moment.
What other challenges that you raised the issue of salaries, and you've raised the issue of transport, but what are the psychological issues that you're facing now? I'm sure that it's a very draining and a stressful time for nurses working and dealing with this pandemic.
Yes, it's very stressful indeed, and we are trying to encourage the ministry to continue train or give training to our healthcare workers, continuous training on COVID. That is one thing that also is the stress among the nurses, because when they know what they are doing and they know to prevent themselves, it's and also is the stress. And one thing, again, we are calling on the government also to provide psychological support to our nurses, especially those ones who are working with positive cases and those who are infected with this virus.
Mr. Shilunga, we've seen that Windhoek has overtaken Walfish Bay as the epicenter, and there's also noticeable increase of COVID-19 in the north. Do you think there are enough nurses and resources to deal with the rise in cases?
No, the answer we don't have enough and capacity to do this pandemic. Now the pandemic, this spread across the country, and Windhoek being the epicenter now of I think Valves and the Rongo. You can see that and the nurses there, and it's not only the communities that are taking, they are that are being affected, but the nurses who are the majority of the nurses who are infected are from Commerce region now. That means the position that were occupied, people who are under isolation now, it means they are back. So this country has been battling with a shortage of nurses, and it's just going to be worse if the government is not going to react and maybe try other means to check in neighboring countries, because we have countries with a lot of unemployed nurses. Maybe if the country can look into those countries and negotiate with, so that they can get some nurses to assist. Otherwise, it's going to be catastrophic.
We saw yesterday, I don't, if you followed that the Ministry of Fisheries, the auction of fishing quotas, a total of 630 million has potentially been raised for the COVID-19 pandemic. What would you say? How best can that money be? How best can that money be utilized to fight this pandemic?
Yes, it's a good initiative if the money is going to be used properly. The money that was allocated first, don't know what was used for, and now look at the $500 million that is now from the quotas. Still, we celebrated this moment because we know our government is reckless when it's come to the spending of money, and how they benefit themselves through other means. So as a union, we are not impressed at this moment. We're still going to check how they are going to utilize the amount of money they have.
And then, what is your views on the recalling of student nurses?
No, we welcome the recalling of student nurses, and if you remember, released a statement a few months ago to say the nurses must make sure that they well equipped with and they must be protected. Otherwise, to be it will impact the students, because already battling the shortage of PPEs and of the students who are being sent by this institution, providing them with their own people. Yes, and these students are vulnerable, and they didn't COVID, and even just training on the infection control. So I was wondering, because some institution even said first, imagine a first year student crisis. So we have a number also of students contracting the virus, especially in and we welcome those institutions to the students.
And then, what is your message to government in terms of dealing with the COVID-19 pandemic?
My call to the government is that they need to do is to the provide them proper equipment, PPEs, and they must also initiate by our nurses. It takes a relief, or it will not do any harm to the government, but it will also motivate more, raising their lives and the lives of the trying to save the communities. So the government must into those things, and also consider sourcing other from other countries if they can, if there's that opportunity, because the shortage is going to hit us hard and it's going to demotivate more. And if our people are going to be demotivated like this, to be overwhelmed like this, we are going to invoke the Section 42 of the Labor Act to save, and we are going to program work. It will not take us time to do that, and we can do it anytime. So the government must consider all those things.
Thank you very much for joining us on the Evening Review, Mr. Shilunga.
Thank you very much, my brother.
Please do stay tuned for the weather. Good night.
Dear invited guest, the Northern SME Expo team is aware of the current restrictions imposed on the country by Honorable President Hage Geingob as from the 12th of August 2020. However, we have developed a system that we can use while adhering to the new regulations. Our team will provide you with a ticket that contains details of the media launch as well as a timestamp at which your presence is required. As per new regulations, only 10 individuals will be present in the media hall as per timestamp indicated on the ticket. Thank you for understanding and for your cooperation. We are excited to see you on Friday. For any queries, please contact Nangula Nashandi on 081 4769 304.
This event is proudly brought to you by Chico Group of Companies.